desk spin, we clock the flow. Cards in the tray, claims in a row. Codes line up, clean and tight. Catch that claim before it takes flight. Verify, refile, move it through. One little miss can slow the queue. We don't guess, we know the drill. Got the ledger, moving still.
Check the date, check the name, trim the track, keep the game. If it bounces back, we make it right. Work that cycle through the night. Moving, keep it moving. Keep it moving, we got it moving.
You know, when I was going through med school, I knew absolutely nothing about revenue cycle. And then I got into the real world and I realized very quickly that revenue cycle is the lifeblood of any provider practice or health system. My name is Getting You, and I'm really excited to be here with Abhinav Shashank, co-founder and CEO of Innovaccer, and Jim Bonomo, founder and CEO of CaduceusHealth. Welcome. We're super excited to announce that Innovaccer is acquiring CaduceusHealth today. Abhinav, you and Innovaccer have been building the infrastructure and the foundation of health for healthcare systems for the last 10 years. Why invest in revenue cycle right now?
I think when we started off the company, we've talked about this a lot. Like our general thesis was the fact that information being fragmented across systems is such an important problem to solve. Like everything downstream only happens better if you know the context of the patient. And once you have the unified view of the patient, you can start basically delivering better care outcomes, better quality outcomes, better affordability outcomes, and a lot of the things that we've all aspired for in healthcare forever. As we've started doing that, one of the things that we've realized is that the administrative burden to do things downstream is just so hard. And so because of that, what we've realized is that you can set up the best infrastructure, in the world, but it does not mean much unless you've basically created the administrative simplification that is required for you to deliver better care. And when we met Jim for the first time, that is what we realized, that he and his team had been working on these incredible processes that eliminate some of that friction of how do you manage things from a payer perspective? How do you basically get the doctors paid on time? And that was just such a clicking point for us to really think about that if we can get the two companies together, that could be such a massive unlock for all of the customers that we are trying to serve for betterment of healthcare per se.
Jim, you started the company in 1997. You've seen, I'm sure, wave after wave of technology advancements. Every time probably companies purporting a new automation, a new way to improve revenue cycle, but hospitals and health systems are still drowning in denials. It doesn't seem to be getting any better. What do you think makes Innovaccer different?
Yeah, no, when I met Abhinav, I mean, we've been through this before. We started it 30 years ago, so we've seen the glorified typewriters punching out 1500s, and hopefully you got the modifier right, you got to retype the whole form. I mean, we've been around for a long time. And our biggest challenge has always been all the data has been in silos, right? And when I started talking to Abhinav, right away I got what really clicked was the unified data set, right? So we can start surgically pulling data from whether we need it from registration, authorization, anywhere in the pipe that we need to pull that missing piece of data. It's going to be available through the Innovaccer layer. We've spent 30 years trying to perfect with the data that we had accessible, that whole process of getting a claim out clean the first time. And that's really where it's come. But when I started looking into Innovaccer and what they had produced, I was like, we can start running in this atmosphere tomorrow at a much higher competency rate. We're doing the really hard work. We're doing that last 20% that nobody really can get done. You can't get that done offshore. That is a really high technical person. And what Innovaccer brings is it's going to allow us to move and do that a lot quicker and a lot better and a lot faster.
You know, you're absolutely right. Everybody's talking about you can't hire your way out of this problem. And so many health systems have also, tried to go out and find, point solutions, right? I mean, EHR can only do so much. So you could try to find somebody who might solve one part of your prior auth, or, maybe you can bring some AI encoding. Abhinav, why hasn't that worked, and what can we do differently?
You could effectively, start thinking about reimagining what your entire revenue cycle process looks like, whether that's value-based care, whether that's fee-for-service, and really think about the right financial outcome that you can generate as a provider while delivering the care that you want. What are the two things that we all want? We want, a frictionless experience for the provider, and we want effectively for them to get paid for what they basically deliver. Right? And if that's basically the two goals that the health system CFOs or CIOs are effectively trying to solve for, then you can, for the first time, really reimagine that entire thing.
If there's a fundamental shift in healthcare delivery towards, a truly transformative way that we actually practice medicine and get paid for medicine, I think that's going to be an absolute game changer. And even still, it's not going to be just take it off the shelf and it'll work for everyone. I mean, there's a deep ability to really understand what's going on with the customer and ensure that our solutions work. And Jim, I think CaduceusHealth has done that so well. You have a really genuinely unique way of starting with the diagnostics whenever you start with any partnership. Can you tell us a little bit more about that?
Yeah, I mean, over the years, as I said, we've been doing this a while. And one of the processes that we found out early on is something that we created called LEAP. So it's called Leading Edge Acceleration Program. And what we've really done is put all of our efforts in that first 60 days of a claims life cycle. And again, when I started talking to Innovaccer, I said, so the earlier we can get good data, obviously the better outcome we have in that 60-day window. And so we start literally as soon as that patient is dialed into the system, as soon as we're having any kind of contact with that patient pre-registration, that's really when the claim process starts. And that's when we want to start thinking about getting paid. So anything we can start adding to that as the patient goes through the process of seeing a physician, we want to build on that. And that's what we've done. So we've created what we call LEAP, and we're so really hyper-focused on delivering a cash result within that 0 to 60 window. And what it's allowed us to do is spend less time on actually a denial, because what we're trying to do is make sure that it's passed every single rule that it could possibly pass, so we know it's going to get paid when it shows up at the insurance company who has to adjudicate the claim.
Jim, can you talk to us a little bit more about some of the customer outcomes you've been able to deliver with this model?
Absolutely. So when I talk about our KPIs and our experience and our results, it's really all based around something we call LEAP, Leading Edge Acceleration Process. And what we like to do is get that KPI into a 90 to 95% settlement ratio in a 0 to 60 window. So we're hyper-focused on driving cash for our clients. And if you're really good at that, I mean, if you can get a client into a 90, 95% ratio, what that really means is you're only letting about 4% trail out in pure denials, right? So you've got to get the picture perfect in the beginning, but what it translates to is a very healthy window in your 60-day cash cycle. It's the reason we've had clients like Englewood that have been with us since 2015. There's a group, here's a group, they started out with about 40 to 50 physicians back in 2015 when they came to us. And today they generate about $240 million in cash, and the practice has grown to about 900 physicians. And they've been a client for us for a long time because of those results. And one of the early things that, brought them to us and what we were able to do with our LEAP was actually increase their same store sales by about 15%. And they'll tell you that. I don't need to tell you that. But that's been a very big success story. And we've built a lot of our models and done a lot of our testing with them. They've been a great client, a long-term client, and they just re-signed for 5 years. So we feel pretty good about them.
I want to close by bringing it back to patient care, because I think, we talk about all this about administrating healthcare, but I think everybody in healthcare is here to make sure that patients get the care they deserve. What do you think this transformative approach is going to mean for patients?
I think like my general view is that you can't think of like patient care without like thinking about the administration of care, like I think in meaningful ways, right? And if you basically solve the administrative like part of the problem, I think the care delivery automatically follows. So that's my view. Like 10 years in healthcare teaches you one thing, that if you can't bring all of the components together and you create another silo, nothing gets solved.
Again, it's driving costs down. I mean, how do we simplify this? I mean, I love the example of what Innovaccer's done. Just something simple like authorization, how something used to take 45 minutes now takes 45 seconds. I don't know if I have that stat right. That same mentality has not been brought to RCM yet, right? And so that's where you start driving costs down. That's where we're taking the really complex case, figuring out how to agentify it, starting to do that in a much smaller time scope, and being able to provide that service at a lower cost, because the costs are driving the small practices out of business. So I really think that we can do that together, and that's why we're joining forces here, to try to drive the numbers down and make healthcare more simple.
Well, I think on that note, we can all agree that if healthcare was more focused on the provider and on the patient, we would have a better world. So thank you so much for joining me for coffee, and let's go get it.
Yeah, no, it's been great. Very exciting day.
Yep. Thank you so much.